Now, the medications that you first discussed with Sebastian, do you ever have the situation where you've got a patient you know is going to respond and is the perfect candidate, but you are hit with a brick wall trying to get coverage? Some of these drugs are extremely expensive. Do you find that depending on a patient's insurance that you may be not able to get the drug as quickly as you want, or there's a lot of hurdles in getting coverage to start the medication as soon as possible?
So you mentioned before some of the ways that we assess whether or not somebody is responding to treatment, and that actually is dictated by insurance. So we're utilizing scales that were really created for research purposes, and now we've had to bring them into the clinic because of insurance mandates. And so we will do testing. I'm sure you love these clinic days where we put you through hours of testing. So my physical therapist and occupational therapist in clinic we'll perform things like the revised upper limb module, which looks at upper limb strength and it gives a standard score. Something called the Hammersmith Motor Function Scale Expanded, the HFMSE. We do that as well, which looks at all sorts of muscle strength, so leg muscles, arm muscles, hip girdle muscles, and gives you once again a collective score. So those are two that are applicable to somebody that is Sebastian's age, and then we have different scores for our children, our babies, with things called the Heine and the chop and tend. And so we do that at baseline pre-treatment and then every 6 months. And we are mandated to do that in order to authorize and reauthorize these medications.
Sure. Sebastian, you mentioned that you were in college when you first heard about this. Did that mean that you had to travel a long way to get treatment with Dr. Proud, but going to a centre of excellence, was it a real inconvenience to start off getting treatment?
Actually, no. I went to Hampton University, which is still within the area of Virginia, so I didn't have to go as far. But I know if Dr. Proud said if I ever traveled outside of Virginia or moved, that there would be a way that I could still come back and still get the medication that I need.
And the initial medications, we've heard that there are a number of treatment options on the horizon, and some are already being used regularly in clinical practice. There's obviously oral medications, and then we hear about therapies that are going directly into the spinal cord. Can you elaborate a little bit on the medications that Sebastian got and the mode of delivery that those treatments took?
Mm-hmm. So the first FDA-approved treatment is nusinersen or Spinraza, and that is a medication that acts on that backup gene that we were talking about. And what it does is it works on that SMN2 gene to improve production of the survival motor neuron protein. And so that's what Sebastian receives. It is currently the only one that is FDA-approved for patients of his age. And it is an intrathecal infusion, and so that means I deliver it through a spinal tap. And it's done in 2 phases. So the loading dose phase with administration on the first day of treatment, followed by another treatment 2 weeks later, 2 weeks after that, 30 days later, and then every 4 months.
So Dr. Proud's talking about this injection that you got into your spine. Quite a scary thing to go through. Had you had spinal taps before receiving this medication?
No, not at all.
So when she first told you about receiving a medicine that was going directly into your spine, what did you think about that?
I don't know about that one. But I said, well, we're already here. Let's go ahead and try. But I was a little freaked. I mean, I have a bunch of tattoos, but something going in the spine was a little scary, but
and you had that done in the office, did you?
Yes. So she gives an option that you can get, put ice, that she does a numbing cream, and then you can put ice on it. I'm starting to realize I like the ice a lot better because it does numb the area a lot more. And then from there, I'm kind of in like a fetal position, and she she goes ahead and gives me my infusion from there. So.
And how soon after getting the infusion did you start to notice some improvement in your symptoms?
All right. People may not believe me, but the first time I got it, my legs were like feeling warm. So I'm like, okay, I think it's working now. But
your parents called me the next day.
Yeah, I told them. But
they said he's outside washing the car.
Yeah. But I would say within the next couple of months, I did start to see a difference. I wasn't falling as much previously before getting my medication. I used to fall a lot. My leg or my knee would give out a lot. Now I have a lot more strength. I'm able to do a lot more things than I was able to do. as well as being able to drive. That was a big concern for my parents, of losing that motor skill. I'm still able to drive. I still have some things that I'm still working towards, but my strength is a lot better to where it's maintaining so I don't end up hurting myself further.
And how many injections have you received into the spine?
She's going to have to answer that.
Roughly.
Yeah.
You've been on treatment since April of 2018. Many.
And what's the sort of time frame between each infusion?
So now he goes every 4 months in maintenance phase.
And the dose for maintenance is a lower dose than the original doses?
No, it's actually all the same, which is
Really?
interesting. And it's all the same no matter whether you're an adult or a baby.